Welcome back to Cellular Wisdom, the podcast where we dissect health myths with a scalpel and a smile. I'm your host, Ethan Foster, here with the ever-sharp Alara Sky.
Hello, everyone, and thanks for tuning in. Today's topic is ripped straight from the headlines, the Great American Healthcare Wasteland. Buckle up, because it's a bumpy ride, but hopefully an informative one.
So, Alara, they're telling me we spend almost $1 trillion a year on healthcare in the U.S. That's a lot of avocado toast we could be buying instead.
True, but unlike avocado toast, this kind of waste has negative health consequences. We're talking about unnecessary procedures, inflated costs, and a system that seems more focused on profits than people.
Right? And it's not like Americans are glowing beacons of health because of all this spending. In fact, our life expectancy lags behind other developed countries.
Exactly. It's a classic case of throwing money at a problem and hoping it goes away, except the problem multiplies and mutates into a monstrous insurance bill.
So, where's all this waste coming from?
Well, Ethan, let's take a trip to a place I like to call Overserviceville. Here, doctors get paid more for churning out procedures, regardless of whether they actually help the patient.
It's like an amusement park ride, but instead of fun, you get a hefty bill and a souvenir stent.
Precisely. And don't forget about the land of end-of-life extravaganza, where people are hooked up to machines long after it makes any sense.
All because families are pressured into making impossible decisions in the midst of grief. The medical industry could learn a thing or two about compassion.
Amen to that, Ethan. But wait, there's more. In the heart of Overdiagnosis County, we find healthy people being treated for diseases they don't even have.
Sounds like a Kafkaesque nightmare. All this unnecessary intervention can actually be harmful, right?
Absolutely. Radiation exposure from excessive tests, weakened immune systems from overmedication, it's a recipe for disaster.
So, Alara, how do we escape this healthcare funhouse?
The good doctor, Dr. Mercola, actually offers some solutions in his article. We're talking about promoting evidence-based medicine, not the latest fad treatment.
Because sometimes less is more, especially when it comes to unnecessary procedures.
Exactly. We also need to overhaul the way doctors are paid, focusing on quality care over quantity of procedures.
It's all about aligning incentives, making sure everyone's working towards the same goal, a healthy patient.
And let's not forget about palliative care. Open conversations about end-of-life wishes are crucial to avoid unnecessary suffering.
It's about respecting a patient's autonomy and dignity, even in their final moments.
Finally, we need to educate the public about the risks of overdiagnosis and unnecessary treatments. Knowledge is power, even when it comes to navigating the healthcare maze.
Empowered patients are healthier patients, that's the motto.
So, there you have it, folks. A glimpse into the wacky world of healthcare waste, but also a ray of hope for reform.
Remember, knowledge is power. Now, let's delve deeper into some of these issues. Dr. Mercola mentioned stents as a prime example of overtreatment. Can you elaborate on that, Alara?
Absolutely, Ethan. Stents are these tiny mesh tubes inserted into arteries to keep them open. They're often used to treat heart disease. However, studies have shown that in many cases the benefits of stents are minimal, while the risks, such as bleeding and infection, are significant.
So, are doctors unnecessarily implanting these stents for financial gain?
It's a complex issue, Ethan. The fee-for-service model incentivizes procedures, and sometimes a doctor might lean towards a more interventional approach, even if a less invasive option would be more appropriate.
It sounds like a system ripe for abuse. What about mammograms? Dr. Mercola mentions false positives and unnecessary anxiety.
You're right. Mammograms are crucial for early breast cancer detection, but they're not foolproof. False positives are common, leading to unnecessary biopsies and even mastectomies, causing significant physical and emotional trauma.
And all this for something that may not even be cancer. It's a terrifying thought.
Indeed. The guidelines for mammogram screenings are constantly evolving, and it's crucial for women to discuss their individual risk factors with their doctors to make informed decisions.
This whole situation highlights the importance of patient-doctor communication.
Absolutely. Open and honest conversations are key. Patients need to feel empowered to ask questions, express concerns, and understand the potential risks and benefits of any proposed treatment.
But how do we empower patients when the system often feels overwhelming?
That's a great question, Ethan. We need to improve access to reliable health information. Tools like the internet can be incredibly helpful, but patients need to be able to discern credible sources from misinformation.
And what about the role of the media? Do you think they contribute to this problem by sensationalizing certain health scares?
Absolutely. The media often plays a significant role in creating health anxiety. Sensational headlines about the latest miracle cure or the next impending health crisis can lead to unnecessary fear and drive patients towards unproven or even harmful treatments.
It's a constant battle against misinformation. How can we combat this?
Critical thinking skills are crucial. Patients need to learn to question information, look for evidence-based sources, and consult with trusted healthcare providers.
And perhaps we need to hold media outlets accountable for spreading misinformation, especially when it comes to health.
That's a good point. We need to encourage responsible reporting and promote a more nuanced understanding of health issues.
Moving on, Dr. Mercola discusses the importance of palliative care. Can you explain what that is and why it's so important?
Palliative care focuses on improving the quality of life for people with serious illnesses, such as cancer or heart disease. It addresses physical, emotional, and spiritual needs, providing comfort and support during challenging times.
So, it's not about prolonging life at all costs, but about making the most of the time that's left.
Exactly. Palliative care can be provided alongside curative treatments, offering a holistic approach to patient care. It emphasizes comfort, pain management, and emotional support for both the patient and their loved ones.
It sounds like a humane and compassionate approach to end-of-life care.
It is. Open conversations about end-of-life wishes, such as advance directives, are crucial to ensure that patients' preferences are respected.
This brings up another important point: the lack of transparency within the healthcare system.
You're right. Patients often feel lost in a sea of medical jargon and confusing bills.
It's like trying to navigate a foreign country without a map.
Exactly. We need to improve transparency and patient-centered communication. Hospitals and doctors need to do a better job of explaining procedures, costs, and potential risks in clear and understandable terms.
And perhaps we need to empower patients to become more active participants in their own healthcare.
Absolutely. We need to encourage patients to ask questions, seek second opinions, and advocate for themselves.
This is a complex issue with no easy answers, but by raising awareness, promoting evidence-based medicine, and advocating for systemic change, we can work towards a more efficient, equitable, and patient-centered healthcare system.
I couldn't agree more, Ethan.
Now, let's explore a few more aspects of this issue. Dr. Mercola mentions the significant role of administrative waste in the healthcare system. Can you elaborate on that, Alara?
Absolutely. The U.S. healthcare system is notoriously burdened by excessive administrative costs. Think mountains of paperwork, complex insurance regulations, and redundant data entry. This administrative burden not only drives up costs, but also diverts valuable resources away from patient care.
So, it's not just about unnecessary medical procedures, but also about the sheer inefficiency of the system itself.
Precisely. Imagine a doctor spending more time navigating insurance paperwork than actually treating patients.
And what about the impact of technology on this issue? Are electronic health records really improving efficiency?
That's a great question, Ethan. In theory, electronic health records, EHRs, should streamline communication and improve patient care. However, in practice, many doctors find them cumbersome and time-consuming. The constant data entry can distract from patient interactions and increase burnout among healthcare professionals.
So, the technology intended to improve efficiency is actually creating more work.
In many cases, yes. EHRs often require extensive data entry, even for routine tasks, which can be a significant time drain for doctors and nurses.
This raises another crucial point: the impact of burnout on healthcare providers.
Absolutely. The constant pressure to see more patients, navigate complex regulations, and deal with increasing administrative burdens can lead to significant burnout among doctors and nurses. This not only impacts their well-being but also compromises patient care.
It's a vicious cycle. Burnout leads to lower morale, which can lead to poorer patient outcomes, which in turn further exacerbates the problem.
Exactly. We need to prioritize the well-being of our healthcare providers. This includes reducing administrative burdens, improving work-life balance, and fostering a more supportive and compassionate work environment.
And what about the role of pharmaceutical companies in this equation?
Pharmaceutical companies play a significant role in the healthcare system, but their profit-driven motives can sometimes have unintended consequences. The high cost of prescription drugs is a major concern, and the aggressive marketing of certain medications can sometimes lead to overtreatment.
It's a delicate balance. We need to ensure that pharmaceutical companies have the resources to develop innovative treatments, but we also need to prevent them from exploiting patients.
Absolutely. We need to promote transparency and accountability within the pharmaceutical industry. This includes ensuring that drug prices are fair and that marketing practices are ethical.
This discussion has highlighted the multifaceted nature of the healthcare crisis. It's not just about overtreatment and waste. It's about a broken system that needs to be fixed from the ground up.
I couldn't agree more, Ethan. We need a system that prioritizes patient well-being, supports healthcare providers, and ensures equitable access to quality care for all.
It's a daunting challenge, but not an impossible one. By raising awareness, advocating for systemic change, and empowering patients to become active participants in their own healthcare, we can work towards a healthier future for all.
Thank you, Ethan. That was a very insightful discussion.
Thank you, Alara. It was a pleasure, as always. And thank you to our listeners for joining us. Until next time, stay curious and stay healthy.